Hi, I'm Dr. Joe, sports chiropractor and clinic director here at Full Function Rehab. This is video series number 4 on concussions, and we're going to be talking about the rehab process and what we follow here at our office to get people back to their sport, return to play, or get them back to their normal functioning process. So we follow a particular protocol that we have learned through our certification training, and a lot of the times that follows research. The most recent concussion conference in Zurich is what most clinics and clinicians are using as protocol. Now it's called the graded exertional protocol, and it follows 6 steps. And we follow these 6 steps to a T, and we try and educate our concussion patients on making sure they also follow it at home and in our office, so that way that doesn't cause any injury. So first, above all, concussions is it needs rest, no activity. That's our #1 rule, and our #1 graded exertional protocol is full, complete rest. Cognitive rest, social rest, no texting, no TV, staying in a dark lit room, limited exposure. This helps the brain calm down from the initial injury and allows the process of healing to start. Once the patient has less or as least symptoms as possible, we start the actual graded exertional protocol, and we go to step #2. Now step #2 is termed as light aerobic activity. So the person can participate in some light swimming, go on a treadmill light walk, or some bicycle riding. So things like that to stimulate the blood pressure, to go to the brain to see if it has an effect. If within 24 hours after being tested and doing that in office, the patient has no symptoms, we can advance them to step #2, or step #3, sorry. If they still have symptoms within the 24 hours, then they either stay at level 2 or they go backwards to level 1 until the symptoms calm down again, and then we could progress them. If we do progress them to #3 is called sports-specific activity. So we increase the amount of activity. So if they're a hockey player, soccer player, in office we try and mimic their sport-specific skills. So lateral lunges back and forth, burpees up and down, a little bit more jogging, a little bit more strength training, things like that to mimic their sport. Whether they are an athlete or non-athlete, we do things to either mimic their sport or just everyday life exercises. Same thing, if they've been within 24 hours symptom-free, we can advance them to step #4. Now for sport-specific people, #4 is considered non-contact training drills, where they go on ice, on field, at their sporting activity, at practice, and they participate in drills, wearing a different color uniform so people know that they should not be hit or no contact should occur. Now this allows us to get a better idea of doing actual sport activity, how the person feels and how they function. Again, they report back to us 24 hours, symptom-free, we can advance them to step #5. If not, they stay at step 4 or go backwards to step 3. Step 5 is full contact practice, where we send the patient out to practice, same color jersey as the rest of the team, and they are getting hit, they're participating, full-on practice. We get to see how they're feeling, how their brain is reacting, and same thing, 24-hour reporting period. If they are free of symptoms and they're feeling good, we move them to step 6, which is called return to play. We're giving them clearance to play, and we send them back to their family doctor, pediatrician, specialist with a clearance letter stating that they've completed these exercise protocols. Please sign off, do a final checkup on this patient, and release them from a concussion symptom and concussion therapy. So final approval is always done by a medical doctor, sports medical doctor, or specialist who the person has been seeing. We are just the rehab specialists in this, and we try and make no final judgment call except something verbal. But everything on paper has to be done by a medical practitioner. So this is a 24-hour step-by-step process. In this rehab process, we are also participating in chiropractic, physiotherapy, treating people's necks for whiplash, tension, and spinal lockup, which can also result in increased symptoms and further make the concussion problematic. So we treat the patient as a whole, whether it's their symptoms and getting them rehabbed back to shape, or we treat their neck, their middle back, whatever was affected from the actual injury itself. Thank you very much for staying tuned to all our videos. If you have any questions, please leave me a comment below. If you know someone or have experiencing a concussion, please seek out a certified concussion specialist like myself here at the office, and we can certainly help you. Thank you very much. Take care.
Bye.